You're watching Mirror 7 News. Stay informed, stay ahead for more news.
Hey, so there's been a big measles outbreak happening in the United States lately, and it's really stirring up a lot of concern. The situation is especially worrying because measles was declared eliminated in the U.S. back in 2000, meaning it wasn't spreading inside the country anymore. But now, over 300 cases have popped up across 40 states. And tragically, there have been 3 confirmed deaths. This outbreak actually started in a rural Mennonite community in West Texas, where vaccination rates were quite low. Because of all these cases, experts are saying the U.S. might lose its elimination status. Basically, the country could no longer claim that measles is under control here. Dr. Noel Brewer, one of the public health experts who tracks this, called the outbreak a complete and utter failure of public health. The status of elimination means new measles cases only happen when someone travels abroad and brings the virus back. But now, with this surge in cases, it seems almost impossible that the U.S. hasn't lost that status yet. The measles virus is incredibly contagious and can be deadly, especially for kids, with about 1 to 3 out of every 1,000 children infected dying from complications like severe respiratory or neurological damage. What makes this outbreak even more complicated is the mixed messaging coming from U.S. Health Secretary Robert F. Kennedy Jr., who has been in the spotlight. While he officially supports the MMR vaccine, the vaccine for measles, mumps, and rubella, he has also called it a leaky vaccine, and suggested it hasn't been fully tested for safety, which is misleading. He's recommended other treatments like vitamin A, steroids, antibiotics, and even cod liver oil as potential remedies, which experts say can confuse the public and indirectly undermine the importance of vaccines. Kennedy's approach has sparked controversy beyond just messaging. He recently fired 17 members from the Advisory Committee on Immunization Practices, a panel of vaccine experts, and replaced them with new members, some of whom are skeptical about vaccines. This move has alarmed many in the medical community, because the ACIP is responsible for reviewing and recommending vaccine policies in the U.S. Critics say that firing the entire panel wiped out important expertise and institutional memory, leaving a group that might not prioritize vaccine science as much. Kennedy has also pushed to remove the thimerosal, a mercury-based preservative that's been used safely in vaccines for decades, from flu shots. Despite strong scientific evidence showing the thimerosal is safe, Kennedy has long claimed it causes autism, a theory thoroughly debunked by extensive research. This kind of misinformation makes it harder for doctors and public health officials to do their jobs and protect communities. Under Kennedy's leadership, the U.S. Department of Health and Human Services has undergone major changes, including cutting 20,000 workers and canceling millions of dollars in funding for mRNA vaccine research. He's questioned the safety of mRNA vaccines like those used for COVID-19, and has removed recommendations for COVID vaccines for certain groups like healthy children and pregnant women. These moves have been criticized by many health experts who say they put lives at risk. All of this has created a confusing landscape for Americans trying to make sense of vaccine advice during a serious measles outbreak. Experts are urging people to trust the science and get vaccinated to stop the spread. Measles is extremely contagious, and outbreaks like this can grow fast in communities where fewer people are vaccinated. The hope is that the U.S. can regain control of the situation and make vaccines boring again, meaning just a normal, routine part of keeping everyone healthy, without the controversy or confusion clouding the message. Stay subscribed for more videos.